You're still watching the morning show on this Think Tank Tuesday right here on ETV. Thank you so much for starting your morning with us. And we continue with the conversations of Think Tank Tuesday. And today's Real People Tech Stories is both innovative and life-changing. Phythos Technologies and the Breast Health Foundation have teamed up to launch Phylaxis.ai, a first-of-its-kind platform that's transforming how we raise awareness and detect breast cancer. And joining me this morning to share more of this very incredible initiative are Louise Turner, who is the COO of the Breast Health Foundation, and Kabelo Sejaphala, who is the Program Director at Phythos Technologies, and they join us to unpack what this beautiful relationship is. Good morning, welcome to the morning show.
Good morning, thank you.
Morning.
It's great to be chatting to you about something that is so real, but this collaboration has really partnered together to make something so amazing. I'm not even sure who to bring this first to, but how did this actually come about? What inspired this relationship? Maybe, Kabelo, let me bring it to you.
Well, our journey started about 7 years ago.
Wow.
Yeah. And we were just thinking about how we can make healthcare much better in South Africa using technology. And we decided to use a data-driven approach. And that's when we met up with Louise about 2 years ago. And yeah, she is the COO of the Breast Health Foundation, and they wanted to spread awareness.
Yeah.
So we took data, which was collected by doctors and data scientists, and we came up with an assessment tool. And through this tool, we are able to spread the awareness that they need to do.
Yeah, man, I mean, this must be phenomenal, Louise. I mean, you've been doing this for a number of years, but now being able to see technology partner so beautifully what you've already been doing in assisting with awareness must be sort of almost groundbreaking, so to say.
What we do at the Breast Health Foundation, we're all breast cancer survivors ourselves, and we do group and one-on-one education in the communities, in the public clinics, etc. With this technology, we are able to do it countrywide. You can do it anywhere in the country, takes a few minutes, doesn't use a lot of data. And I think the big challenge we have in our country is that health literacy is a problem, not only for breast cancer, but for all health-related issues.
Yeah.
And with this technology, anybody can go answer a couple of questions and get the correct medical information back in the report that you receive. There's a lot of myths and misconceptions around our country about breast health, breast cancer in particular, and this assessment tool addresses those myths and misconceptions. It also gives you the medically correct information regarding screening, when to check, the risk factors regarding your own health, and it's a way we can reach so many more people without actually doing it face-to-face or being in those communities. So here we have an opportunity to reach a much larger audience, firstly, and I think what's really great for us at the end of the day is because it's data-driven, we can take that data and we could look at per region and see what the health literacy is in that region and adapt our education to take into account the literacy of that region. You know, some people might think that the microwave or the cell phone in the bra causes breast cancer. So in that particular region, we can address that myth, where we might not know that that is what many people in that region think.
Yeah,
so there's a
no,
multifaceted level here. Not only are people educating themselves, but we can look at the data and go, okay, this region, there's a lot of myths regarding this. Let's now address those myths when we educate in that region.
That is fantastic, yeah.
I'm very excited about that because a lot of the education we do is the doctors tell us this is the education you want to do. And women are shy. They don't want to ask questions about these things in a community environment. So we can now assess it with their help and with the data and change the way we are doing our education in the future.
One of the things that I've seen when it comes to breast health, breast cancer health and awareness around that is early detection is always a very strong theme of the sooner you know, the better it is. And maybe I want to bring it back to you, Kabelo, speaking about how Phylaxis.ai really helps as a technology to assist people in those remote communities to be able to know a little bit sooner to help them with early detection. How exactly does it do this?
So in terms of breast cancer,
excuse me,
Yeah, in terms of breast cancer, the tool basically just, it assesses what you know, right? And then at the end of the assessment, you are given a personalized report, and that report actually tells you what you should know, and it also tells you how you should go about checking for any abnormalities on your breast. And yeah, and it also, it's for both men and women, because a lot of men don't know that they can also get breast cancer.
Yeah.
So we're just trying to make this scalable so that anyone with access to a cell phone could be able to do the assessment. But that's just for breast cancer. And we've also got other modules. For instance, we've got one for sexual health. So that one is more of a risk assessment. So it tells you more of your risk. So you do the whole assessment, and then at the end it tells you if you're low risk, medium risk, or high risk. And in the instances where somebody is high risk, for instance, HIV, then we take further steps of putting you into PrEP and educating you more on your sexual health and how you can protect yourself.
Yeah, and I mean, Louise, this must be incredible, like you're rightfully saying, that you've got all this data that you're able to work with and fine-tune the work you do towards the different communities that you serve. And now you've got more information in terms of people knowing a little bit earlier based on the data that put into the app. Talk to us about rolling this out, which in itself must be quite intricate, so to say, rolling out this program to so many different people, ensuring that they, I don't know how to say this, it's like there's a health literacy problem, but also there's the awareness towards technology and believing that technology is saying the truth, you know, because this app could be telling me, I must watch out, I don't believe this if the doctor didn't say this to me. Tell us about the rolling out so that the people who are on the end, the consumer on the end of this platform is able to not only know more, but able to know that this is just the first step, and the healthcare providers and those that have the professional background is able to back that up and take the next step with them.
So there's a two-phase approach. During October, it's been social media, etc. We do a lot of talks and awareness in October, being breast cancer awareness, where we are going into corporates. Here's the QR code, get everybody in the office to do it. Once we start going back to normal, because there's another 11 months of the year for breast cancer awareness, the team of patient navigators at the Breast Health Foundation will actually be doing the assessments one-on-one with the people in the clinics. So if we're in a clinic and there's 20, 30 people and my gogo doesn't understand how to use a cell phone, the team will have tablets and we will go through it with them one by one. There's other language options, Xhosa, Afrikaans, Zulu, that will assist with the language barriers, because a lot of the words in English, when it comes to health and health terminology, is different in the other languages.
Yeah.
So there's that barrier we're going to overcome, because the patient navigators at the Breast Health Foundation speak various languages. So then we'll start doing the one-on-one assessments in the clinics with the patients. And it also gives us the opportunity, when they get the report and they start reading it and they go, but what does this mean? And that is particularly in the rural and peri-urban areas, where you've got someone you can ask a question there and then. So yes, that's a slow process where we can do 20 or 30 assessments a day, but at least there's somebody in front of you where you can ask a question immediately.
Yeah.
So there's a two-phase. You can do the social media where everybody can sit and do it, but then we're going to start doing the one-on-ones in the communities with the patients in front of you.
This is incredible. I mean, I think that my brain is still struggling to comprehend it so much because this is such a real thing that affects so many South Africans, so many women and men, rightfully, like you've mentioned, and it's important that they know. As we wrap up our conversation, for people who want to know more about the platform, where can they go?
You can go to Phylaxis.ai, spelled Phylaxis.ai, and yeah, you'll find more links there.
100%. And for more people who would want to get more information on breast health, where can they go?
www.mybreast.org.za, or you can just Google the Breast Health Foundation and all the social media will come up there.
100%. Louise, Kabelo, thank you so much for joining us this morning. Thank you for this beautiful relationship and partnership that you're doing for so many other people who would otherwise not be able to know how to go about it. And TMS fam, I don't know about you, it's really beautiful to see how Phylaxis.ai is a powerful example of how technology can make a real difference, not just in healthcare, but actually in people's lives. And TMS fam, early detection saves lives. So let's help spread the word and ensure that more women and men have access to the tools that they need. Stay with us. We'll be right back just after this.